Okay, so the far right picture is the incision that you would end up with years ago to get any type of weight loss surgery. The one in the middle is the traditional laparoscopic approach, where we use typically 4 to 5 incisions to place the band or do the bypass or do any of the other weight loss surgeries out there. This incision here is typically a little bit larger than depicted on the screen because we have to be able to get that port underneath the skin. So that incision is just slightly larger than it's showing on the screen. This picture on the far right is what we're most proud of and most excited about, and that is what you call single incision laparoscopy. And what that means is this patient was able to undergo the entire band placement, hiatal hernia repair, which she had, and also port placement through this one tiny little scar, which is about 2 inches. And how we did that is with this spider instrument, which we are very excited to say that at Palms of Pasadena, I was the first one in the world to be able to place it using this instrument called the spider instrument. And I had attended many courses to train to do single incision laparoscopy with the one port site for the surgery. And I found all of those techniques very difficult. It was sort of like eating spaghetti with chopsticks, if you've ever tried to do that. You're fumbling, your hands are crossing, a very difficult thing to do. So we were very excited when this instrument came out, and we were even more excited to be able to place the first one in the world. And how you do that is with this one instrument. You make one incision, and you place this instrument through that incision. And I don't know if you can tell, there are 4 ports that you can work through. These 2 flexible ports that you can actually move up, down, right, and left. And then there's 2 central ports here that we can place long, rigid instruments through. So one we can place our camera through, and another one we can use a long, rigid grasper. So we have actually 4 sites to work through one incision. So after we place the band with the spider instrument, we can take the spider instrument out, pull the tubing out, and connect our band to that so that we have only one incision instead of the multiple incisions that it used to require to place that band through. So it's a very exciting technique.